Good morning. My name is Jeffrey Silvestri, registered nurse, and this is my intervention presentation and capstone video reflection. Hyperglycemic crisis prevention. Throughout this capstone project, the focus has been on my mother, Jane Doe, a 50-year-old female who has been diagnosed with diabetes over 7 years ago. According to the CDC, diabetes is a group of metabolic conditions characterized by a higher than average level of glucose in the body due to a defect in insulin secretions, insulin action, or both. Diabetes is one of the leading causes of death and health complications in the United States and worldwide. Resources and interventions are being adapted to help minimize and manage complications that may arise from lack of proper management. Daily monitoring of blood glucose level is an essential aspect of appropriate diabetic management. A1C level must be checked every 90 days to see the patient's adherence to medications and treatment. For the Capstone project, the priority is on measures to take to help prevent hyperglycemic crisis. An educational brochure was created to help Jane Doe better understand the prevention plan. Okay. Assess the contribution of intervention to patients' satisfaction and quality of life. The meeting took place over a 2-day period, part in person and part over the phone. A total of 4 hours was spent with the patient to discuss ways to prevent another episode of hyperglycemic crisis. Gross negligence, mismanagement, and noncompliance to insulin and diabetes medication has been an issue for Jane Doe. She has an history of hospital admission due to hyperglycemic crisis that required her to stay in the ICU for a few days. She was in a comatose state. It was a scary moment for her and her family. The patient was eager to learn about different ways to help manage her diabetes and participated actively in the teaching process. She expressed willingness to modify her lifestyle and diet behaviors to regain control over her glucose level. She responded positively to the intervention due to the cost-effective nature and relatively easy to follow directions. Jane Doe made it her priority to fully adopt the intervention provided to maintain blood glucose in the normal range. Interventions such as healthy eating, exercise, insulin and medication compliance, constant visit to her primary as necessary, blood glucose monitoring, and more. She verbally expressed understanding of teaching and ready to improve her health. Some challenges encountered at the beginning of the teaching session on day one was Jane Doe's lack of motivation and her history of insulin non-compliance. She is of Haitian descent, which means English is a second language. Most medical terms are difficult to understand, but modification on my end, such as I presented part of the teaching in Creole or French to make sure that she understood and the intervention and direction that need to be followed. Another major challenge is her diet, which is carbohydrate heavy. Despite advice from nutritionists, endocrinologists, and primary healthcare provider, she was still having difficulty cutting the carbs. By the end of the teaching, patient expressed understanding and is motivated to make the necessary changes to prevent another episode of a hyperglycemic crisis. Jane Doe was thankful for the extensive teaching and visual aid provided. She stated, I've always thought I could get rid of my diabetes with just metformin, but after spending 2 days going over the various ways to prevent another hyperglycemic crisis, I will do everything I can to better manage my health. According to the patient, the intervention was helpful and she's ready to start applying all necessary measures to achieve optimal health. The intervention affected the patient positively in ways that enhance her knowledge about her health condition, and empowers her to take control in order to prevent hospital readmission due to hyperglycemic crisis. To measure the effects of the intervention, it is important to check her A1C level every 3 months, check her blood sugar trend, and ensure that she complies with insulin and other medications. Evidence and peer-reviewed literature. To ensure the best result for the project, the Capella University Library was the primary engine. It is comprised of a vast amount of articles. Database A to Z, nursing, allied, and health, keywords such as healthcare access, diabetes management, DKA, HHS, and more was used to acquire the best article. To ensure that information obtained was accurate and credible, I selected healthcare-related peer-reviewed article within 3 to 5 year period to maintain relevance. Additionally, I reviewed the author's credibility in the topic of diabetes management and complication prevention. Outside sources, such as the American Diabetes Association, the Center for Disease Control and Prevention, the World Health Organization, was used to obtain supplemental information. Evidence-based practice and patient-centered care, when used correctly, will bring positive results to the patient and healthcare professionals. Using both processes can be challenging. When the nurse or educator consider all possible outcomes and barriers to teaching, the process becomes easier and positive outcomes is more likely. Technology. Healthcare technology was very helpful in implementing this project. Technology is an important aspect in our everyday life. From home to the hospital setting, technology takes various forms to make management of life and health easier. For the diabetic patient, using continuous subcutaneous glucose monitoring device, this helps better manage diabetes because it is easy to use, relatively painless. The patient and physician have direct access to glucose trend. Recommendation can be made on how much insulin to administer, if any, in case the patient doesn't fully understand the parameters. The use of technology, the use of telehealth and teledoc system help ensure that the patient keeps up with her appointments without the need of leaving her home. The use of technology to monitor diabetes is cost effective and convenient for the patient and healthcare professionals. Health policy. The Affordable Care Act is one of the more prominent governmental policy that has a positive impact on the patient. Due to Jendo's low income, she was qualified to take advantage of a better healthcare coverage that gives her access to proper glucose monitoring equipment, low cost visit to endocrinologist, in home health care visit every week, and more. One of the ACA's main priority is to reduce disparities in diabetes detection and treatment in minorities. According to the CDC, the goal to decrease disparities was partially met. Methods such as expanding affordable care healthcare to the population is being implemented to help those in need. Healthcare ethics is to take in consideration the patient's specific health problem using values, facts, and logic to produce the right course of action. Ethics are moral principles that govern how the person or group will behave or conduct themselves. The four basic principles are autonomy, the right to self-determination; justice, provide equal care to all; beneficence, doing good; non-malfeasance, do no harm to the patient. All must be applied to give proper and high quality care, according to Haddad and Geiger in 2020. Patient safety is always a priority. One must ensure that the patient receives the proper information and instructions about treatment plan and specific procedure to prevent unnecessary hospital admission, which will lead to increased stress, increasing cost of care, and use of resources. Educators must always evaluate understanding. Employ the Teach Me method, also known as the return demonstration, to confirm the patient is able to perform a specific task in this case, blood sugar monitoring, according to Diabetes Care and Education in 2021. Preventing hyperglycemic crisis is a long-term goal and must be conducted on a multidisciplinary basis. Chester et al. 2018. Capstone project outcomes. The Capstone project matched my initial prediction because it was always my dream to teach my mother about ways to prevent hyperglycemic crisis and ways to better manage her diabetes. Throughout this project, I was able to dive deeper into the diagnosis and help her understand the proper ways of managing her health. Access to the patient was fairly easy over the phone and in person. Meeting was very convenient for the both of us. My intervention can be adapted as best practice. It is simple. It is a simple teaching plan with easy to implement steps that any patient can follow in any setting. The feedback from the patient shows understanding and willingness to adhere to medication and insulin therapy to prevent another episode of hyperglycemic crisis. Personal and professional growth throughout the Capstone project. The Capstone project helped me enhance my teaching and research skills. It provided a better opportunity to help those not able to understand their disease process. Also, my management and communication skills have improved greatly during the program. As a registered nurse, the project will continue to affect me positively by allowing me to provide the best care possible in both the community and in the hospital. During the RN to BSN program, I, as a person, have improved greatly. At the beginning, it was very challenging for me. I was overwhelmed with the workload. I was not able to fully understand the assignments. But the faculties and staffs have helped me to better manage my time and really understand what I need to do. I will be using everything I learned in this program in the field to make a difference in everyone's life. Overall, I had a good experience. Thank you so much for watching.